Hello everyone and welcome to today's webinar on tackling an elective backlog hosted by Orca. I'm Sam Sharp, I'm chairing today and it is great to be here and great to see so many people who have joined. We've got an amazing panel today who are going to speak to you about all things digital health and elective care. So it probably hasn't escaped most people out there that elective care for the NHS and most health services around the world has become a daily topic. But what's really clear is that we've got to do some things differently, very differently. And we need to think broadly, far more broadly than just the single experiences in a hospital setting, but the range of elective experience, whether that's preventative or therapeutic. We know people are waiting up to 2 years in some specialties. So today we're going to have our panel here speak to you about a range of things relating to elective care and all the different parts of the patient journey. But please do join us online, join the discussion, post on here and add your comments, your questions. You can follow us on Twitter at Orca Health and of course post on LinkedIn. Please do prepare your questions because I'll be taking questions at the end, at which point we'll be able to go through those and put them to the members of the panel today. So if you're wondering where to start, do visit the Orca website, or from this webinar, you can take the download of the Elective Care Toolkit. And that's got some great hints and tips and starting points as to what you need to think about when you're starting your journey on digital health in elective care. So today we've got an amazing panel and we've got with us our CEO, Liz Ashwell-Payne, who will be speaking to you about the toolkit and work we do at Orca. We've got Crystal Dennis, who is the head of digital access to services at home at our Dorset ICS. Christian Telfer, project manager for digital access services at our Dorset. And we've got Chris Keegan, who is from the Smoke Free team at South Yorkshire NHS Foundation Trust. And we've got Susan Jones from the same team, who will also be speaking to us about their work on smoking cessation. And of course, Ewan McComsky, who is a digital physiotherapist and works with us in Orca. So it'd be great just to take a moment just to think about what are we doing around tackling the backlog. And what we know is the National Audit Office reports that elective care waiting lists could reach 12 million by March 2025. So a really big incentive to think and work differently across the health system. Now, work that Orca's already done before indicates to us that 93% of healthcare professionals believe digital health tools can improve a patient's health. And 65% of patients are themselves advocates for this. But yet only 3% of the UK public have been recommended a digital health tool by a hospital doctor or another clinician. So plenty of scope there to make better recommendations, but using curated and reliable products. And we know that with 290,000+ digital health products available, only 20% meet the quality thresholds, making the right choice both critical but also challenging. So where is it that we see the backlog and what should we try and tackle? Well, from the research that the team have done, we know that there are 4 areas where we've got a significant backlog across the system. And those are ophthalmology, dermatology, MSK and cardiology. There are more than 390 apps for ophthalmology, 822 for dermatology, 415 in musculoskeletal health, and 721 for cardiology. But which of those are safe? How do you pick them? Which are effective? Well, hopefully today we'll give you a little bit more about this and an opportunity for you to meet and speak with our panel and understand how they made some choices and what they've done and what can be done to help you. Please do post your questions and please do make sure that you link to the report there and visit us on the Orca site. But next, I would like to invite Crystal Dennis and Christian Telfer from the Digital Access to Services Programme at our Dorset ICS to tell us about the work that they've been doing and share with you their journey. Over to you, Crystal.
think Christian's got some slides that he's going to share to start with. We're going to do a bit of a double act, won't we, Christian?
Yeah, I'd love to. So hi everybody, I'm Christian Telfer. I work in the Dorset CCG. My job is rolling out the app library for Dorset and getting it into every corner of the ICS that I can. I also help 6 other systems in the Southwest to roll the library out for their populations, and they're all going live shortly. So we're in quite an exciting space there, and we're really hoping that we can replicate some of that success in Dorset across that Southwest region. So if we have the first slide, please, Helen. Thank you. So let's talk about how we see digital health supporting elective care in Dorset. So to us, elective care is an area which apps have got huge potential to support in terms of the medical benefit they can offer and the practical reality of patients having so much kind of downtime to utilise them. But the challenge really is, how do we make sure that patients are using good apps for that? Because if you asked a typical patient to go on the app library and put together a suite of apps that are going to brilliantly support their journey in elective care, I suspect the majority of them would struggle with it and get quite frustrated. I very much doubt I would fare much better, and I do this for a living, simply because my layman's knowledge of elective care would let me down. So what Orca have done here by putting together this package and segmenting it by condition and also by what point in the journey somebody's on, they're putting in place some really great scaffolding for patients to actually set themselves up for success. And if we think about the elective care journey and the toll it takes on a person, I'm fortunate enough never to have had elective care, but people in my family have. And the thing that has always struck me about it is what a burden, what a lonely road that can be. So we've got a responsibility to not just support them in terms of helping them get better, but helping them cope with that. And I think it's evident in the packages that Orca have put together that they're really going after this holistically. And you can see that from the inclusion of things like WISA for the mental health piece. We're really trying to help them in every way we can. And if we think about the digital framework, the criteria for success, what good looks like, when I look at measure 5, this is ticking that really beautifully for me, because that's all about empowering citizens and giving the patient a consistent and equitable offer of digital tools. That is exactly what this is, because the tools are very much out there. They're there for the taking, but what Orca have done are putting it on a plate and right in front of the patient, setting them up for the best possible journey they can have and getting through that in the best possible condition, I think. So if we could have the next slide, please, Helen. Thank you. I'd just like to talk about how we see the kind of curation of apps into a package or a toolkit and what that does for us in terms of removing some of the barriers that we've observed from our experience in Dorset. So barriers that clinicians face really, and that we face in getting through to clinicians, they're quite deep lying and they're structural, but these toolkits are a really good starting point for helping us get through those, because there's a cultural awareness piece. When we think about a clinician's culture and how they're trained in their practice, they spend their professional life very much embedded in the culture of prescribing commissioned tools from within their system. So when you place in front of them the app library and the vast range of tools that are there, largely non-commissioned, there's a disconnect between what we're asking them to do in terms of recommending those apps and the whole way that they've lived their professional life thus far. So they're generally more happy just signposting towards the app library, and we're perfectly happy with that because that makes sense to us. And sometimes they'll say, you know, there's a great resources on here for diabetes, for example, go and have a look, see if you can find something that's going to help you. And then we've also got the systemic part, accessibility. So a fairly familiar problem for a lot of us, I think. TPP, EMIS, not the most interoperable systems in the world, and they don't really fit, certainly not currently, with the app library. So expecting clinicians to log into something separately against the kind of time constraints and the pressures they're up against, it's not realistic. So if we can marry up the functionality they do have, things like Accurex, with a package like this and put all those great tools in one easy place behind a URL, we're setting them up for success as well, because they can then utilize this work that Orca have done and then bridge that gap between patient and tools. And then we've got the practical element. If you go on Dorset's app library and you do a blank search, you'll come up with something like 2,300 apps. you're never going to scratch the surface of that. There are people using these tools in Dorset and having great results, and some of those I will never know about. And I spend most of my day on the app library. So there's that practical point around how can you expect clinicians to go into the app library and put together these tools? They probably could do it if they were minded to and they had the time, but by covering that piece for them and saying a team of your peers have put together this toolkit and they see it fitting into the elective care strategy in this sense and explaining it to them, that's a much, much softer sell than going to them and kind of saying, here's the app library, can you try and utilize it, please? So we think that going forward, actually, this might well kind of form the template for how we look at a lot of strategic problems when we've got people from within our system coming to us saying, what is the digital solution for frailty, for example? The answer is very often going to be putting together a toolkit and curating things. So we're very grateful in that sense for being able to use this as an exercise in what good really looks like in terms of offering patients tools. So thank you very much. Crystal, is there anything you want to come in on there? Any talking points you want to pick up?
Yeah, so just building off of that, I think that in terms of the awareness piece, having our elective care have a huge challenge, don't they, in terms of recovery, and there really is a need to support the patients whilst waiting and also kind of during and post their treatment, as the report kind of highlights. But actually there is also a there is a need or a barrier around those clinicians feeling that there has been an accreditation or there's been an assurance, so that actually they're recommending something that is in line and is up to date with current regulations, that has good data protection involved in there, that has a good user experience for patients and actually does work. And the systems are very much still learning what good looks like in terms of these tools. So to have that in one central area where it's already been thought through for those clinical specialties just makes that an easier way of overcoming some of those things. And also it makes it a very intuitive tool for our patients to be able to use at the same time in terms of navigating, because certainly we don't want to control what happens. We might think that they're only there to look at maybe ophthalmology, but actually they might be there because they have a child or they have a mum that has a cancer condition. So we want to make sure that we are raising the awareness within the public so that they have a personal choice, but that we're also helping the system to overcome some of the cultural barriers that we have in incorporating digital health tech as part of the care that they deliver.
Thank you, Christian and Crystal. That was really useful to hear that. And I'm going to come back with some questions as we go through this bit later on. But just whilst I've still got you both, Christian, you mentioned something really interesting there around the experience and connecting products together. What would you say the biggest challenge was in surfacing products to the clinicians in a way that was useful to them, that they could easily access?
I think that what Orca are doing is the right way to go about it. How often do we usually text out or hand out to a patient a bunch of leaflets or dietary information, or text over a list of URLs of websites that may be helpful? And of course, different people have different choices in how they learn. Some want to do some remote monitoring of their own condition. Some of them want to have a read through or have a video that shows them some things. And of course, what we're doing is matching online choices currently and preferences in a modern day user experience, which is what our public are expecting. And for a lot of our services, sometimes there is a worry or a natural kind of inclination to kind of keep doing the things the way we've always done them, but via the pandemic, the unintended consequence of the pandemic is that we've all had to have a step change. And so we're using digital in ways that we've never used them before, and we need to keep building off of that and making sure that that online experience is as intuitive for our workforce to navigate, but also intuitive and a good online experience for our public to navigate as well.
Well, it's really, really great to hear that you put sort of the user experience and the design at the heart of what you're doing there. And it really feels like you've thought carefully about the two sets of users, the workforce and the clinician. So we will get into some more discussion in a moment once But now I'm going to invite Susan and Christopher to talk to us about the work that they've been doing on smoke-free. And I think this is really important because quite often people forget that it's not just about elective services in a hospital setting, that's the traditional type of setting that we might have seeing a consultant or someone else, but actually now we've got preventative services as well, such as smoking cessation and other types of service, which also benefits from this approach. So I'm really looking forward to the public health dimension of digital health and elective recovery. So Susan and Christopher, over to you. I'm sorry, Susan, I'm gonna have to ask you to try and unmute.
Thank you. Yeah, myself and my colleague Chris would like to take you through our journey, leading to an increased use and a very successful use of digital health within our services. Could you move the slide on, please? So we are colleagues within Yorkshire Smoke Free, which is an NHS stop smoking service. We have 5 stop smoking services within the South Yorkshire and West Yorkshire areas. So that's Barnsley, Calderdale, Doncaster, Sheffield and Wakefield. Each service is commissioned separately by their own local authorities, but hosted by one trust, which is South West Yorkshire Partnerships Foundation Trust. And this allows us to share knowledge, expertise, good practice and our resources. So prior to March 2020, we were largely a face-to-face service. We were delivering one-to-one clinics, groups within community and healthcare venues. Along came the pandemic and things changed very quickly for us. And having a really, we were already in a really strong position to respond to the COVID pandemic. We had our own website, social media platforms, and we already had this existing partnership with Orca. However, it did feel a bit strange because, as was mentioned earlier, we were largely a service that used to give leaflets. We could be very responsive. So if somebody talked about they had concerns about weight gain, we give them a leaflet or refer them to a service. So it was a big change for us. Next slide, please. So in response to the pandemic, staff moved to home working, which is largely still the case. Instead of having face-to-face appointments, we were having telephone consultations. We were in another good position. We had already almost, if you like, perhaps we had a vision that this was going to happen. We'd already been working on an electronic voucher scheme. So we give patches, gum, mouth sprays, nicotine replacement therapy, etc. To clients, which previously was a paper-based system, but became an electronic voucher scheme. So that came on board April 2020, which meant that we could actually send an electronic voucher to clients via an SMS message, which they would take along to the pharmacy, which would, of course, still open and get the products. And as already I've said, we did already have a website and we had existing social media platforms. So that was really useful. We could put a lot of our paper-based resources on our website for clients to access. Next slide, please. We were very fortunate in we already had an existing partnership with Orca through our organisation Swift. We don't, largely every service member had training on how to use the Orca Pro accounts, how to recommend apps to service users. But as already has been mentioned by Christian and Crystal, it's this bit of a culture thing, and which apps do we recommend, which are the good ones. You visit the library and there are a multitude, so it was very hit and miss really. Some advisors were using it and some advisors weren't, so it wasn't really robustly embedded into service delivery. But we all really needed to provide more resources, more help for our clients. So we recognised the potential for apps, particularly as services were in the same position as us. They had to make big changes, so perhaps weight management services were not delivering the same. And so it gave us an opportunity to get our smokers to access digital support for other lifestyle issues as well. Next slide, please. So I'm going to hand over to my colleague Chris at this point.
I'd just like to start by saying the next couple of slides that I'll be presenting, I do want people to be aware that Christian and Crystal's presentation I wasn't aware of what they were going to talk about, and the next like 4 or 5 slides that I'm going to discuss sounds like we've actually merged these two presentations together. It's everything Christian was saying, I was nodding thinking that's exactly what we found when we as a service started out with Orca back in the beginning of 2020. So it should be interesting to hear our spin on it from what you're suggesting. So let's start. So our current partnership with Orca back early 2020. So with the success and ease of sending apps, both our advisors and clients began to engage with the introduction of health apps into service delivery. So quite early on, we recognised that there's some scope in this. And from what we were starting with at the beginning of going into lockdown, we had nothing, when we could actually see the benefit of starting to do a little bit more with Orca. So for this to work, our advisors felt that we needed a cohort of apps that we had to our disposal, and we knew that what we were sending out there were actually trusted. Because the last thing we wanted to do were suggest a client goes to the Orca library and look for a health app, which may be weight management or physical activity. There's like 500 of each one or plus, so it's daunting. And for an advisor with a 20-minute appointment and you're engaging in a discussion about smoking cessation and a client's now changed the topic to weight management, the last thing you want to do is spend 20 or 15 of them minutes looking for the appropriate app. So for us, the next step was to go back to Orca, and my contact at the time was Lisa Simmons, and I explained that for us to get this working, we need to come up with a cohort of apps that we had access to. And this is where we came together with what's now known as the Yorkshire Smoke-Free Carousel of Apps. And the image on the PowerPoint is our link from the main page of Orca. So when we're talking to clients as advisors, we use that link to get access to our carousel. So currently on the carousel, there's 17 individual health apps. And these apps range from smoking cessation, weight management, physical activity, and then there's also some appropriate mental health apps that we felt necessary to put on there. So whilst we're engaging with a client, if the topic of conversation changes from smoking cessation, we can quite quickly go to the carousel and send an appropriate app as like the first point of call, like a very brief advice we call it, just, you know, it's weight management. And we can also follow that up with an actual physical referral. But at least we know that during that conversation, we've acted upon what the client said, like we would have in a face-to-face service with our bag full of leaflets for every service that goes on in our area. So that's how it began. So if you can change the slide, Ellen. So for us, client feedback Oh, wait, sorry. So service users are now able to view the carousel via multiple Yorkshire smoke-free digital assets, including the new Yorkshire smoke-free client zone. So like Sue was just touching upon that, we had certain digital assets available, mainly the website, but that was more just for sending out our contact details and how to refer into service. What we had to, whilst trying to set up Orca, was develop this Yorkshire smoke-free client zone. And what sits on the client zone is our old paper resources, as well as a link for health apps. We don't use the word Orca when we talk to clients in service. We refer to it as health apps because it's a bit of a barrier. If we said you're going to get something from Orca, they don't have a clue what we're talking about. So we refer it to as health apps. And clients can access that link at any point of the program, and even once the program's finished, they still have access to the client zone and potentially access to the Orca website. So most importantly, advisors are able to directly recommend health apps off the carousel without trawling through the Orca library via our Orca Pro accounts. So as advisors, within less than, I'd say, 30 seconds to 60 seconds of engaging with a client about a lifestyle change or topic of conversation that's not smoking cessation, if it's on the carousel, I can quite easily respond to that client whilst on the phone. I can just send them that weight management app or that physical activity app within, like I said, seconds. And for us, we've started to implement the NHS Smoke-Free app within our initial appointment. And that's where we're going to just continue this conversation a little bit further, because our original thought in early 2020 was, why would we as the Stop Smoking Service recommend a stop smoking app? It just didn't make sense. You know, you could say we looked at it as a bit of competition, where now we see it as, why wouldn't we recommend a tool that certain service users might engage with better than a website or anything like that, because apps are that easily accessible. So can we just change to the next slide, please? So for us, client feedback is very important, and since launching the carousel, we have both added and removed apps off the carousel. And like I say, we've got 17 apps at the moment on there. I think originally when we first launched, there was something like 21 apps. And straight away, we felt like we're kind of duplicating the library in a small sense, because, you know, there's thousands of apps on there. But the last thing we wanted to do is have something the client and the advisor had to trawl through. So we reduced it down to 17, and potentially there's probably room to reduce it a little bit further, because we want it to be quick and easy. And going back to what Christian said, as an advisor, I need to know that if I refer an app to a client, I need to know that app's trusted, it's safe, it's something that they're understanding that they're possibly in that purchase, or it's a free app. I need to know what's about that app, and that's why we're constantly reviewing the apps. And like I said, we're stuck at 17 at the moment. So to take advantage of this, everything is working now from an advisor to referring the apps to the client. But what we also thought was, what about the clients who are, or potential clients that aren't in service? So that's when we turn to our social media. So Yorkshire Smoke Free have, for example, Facebook, Instagram, Twitter, even a YouTube account. We have, and it's all managed by Bigfoot Digital. And what we decided to do was put the carousel out there to our followers for them to also access. And since we've done that, we've noticed an increase in potential service users or just followers accessing the library. And we know this information because each month we get an Orca monthly report. And this basically tells us, and we're still learning because this is all new to us before 2020, but when this data comes to us, we can see when the client lands on the Orca site, where was them before they went there? And what we can monitor is they're coming from our Facebook page. So we know that what we're doing on Facebook is actually being pulled through, and we're seeing that success. And So for us, Bigfoot need to continue doing what we're doing because it's working, you know, and we're always reviewing this sort of how else can we get it out there, normalize apps as part of our service. So next slide. So this is just an example of client feedback. So the template that you can see, there's 17 of these, so one for each app that we promote. And if a new app comes in and one goes, we just create a new template. And when we're speaking to clients, and let's say on week 1, we've sent them the NHS smoke-free app, and it might be weeks 3, 4, 5, 6, wherever it happens, the client mentions that they can't believe the 4-week quit, or they can't believe they've saved £350, or whatever information that app has told them, and they're openly discussing it with a client or an advisor, we will encourage that client to either send us that comment or quote within text, email, or just speaking over the phone, and we write it down and get the appropriate consents, put it on this template, send it back to Bigfoot Digital, who put it out there with a link to the Orca carousel or our Yorkshire Smoke-Free carousel, encouraging other service users or potential followers to download the apps via the link. And that's something that we know that's working also. And we're continuing to promote this client feedback. And this also reviews which apps stay and which apps potentially go. You can just move on to the next slide, please. So this is just another quick example of what we do on social media. So not all the apps do we promote via social media, but the ones like the weight management, the physical activity, and especially the NHS smoke-free app, we will put examples of a national image that is used via the NHS Better Health site, and we'll also include, as you can see, the link to direct, and then again we can trace this back and see where they're coming from. So we know this is working via the Orca report. So if you can move on to the next slide, please. So just want to quickly give you a bit of a run through of how Yorkshire Smoke Free as an advisor, and I am an advisor in the service, how we would use Orca. So like I've mentioned in that initial consultation, at some point in that 40-minute consultation, I will encourage the client to accept a recommendation of the NHS Smoke-Free app. The client accepts, tells me which phone they've got, iPhone or Android. I send the appropriate link via the Pro account. And within, like I say, 30 seconds, it's all done from discussion to sending it off. It's that quick. And that may be the last time that client discussed the NHS Smoke-Free app, or throughout the programme, they might weekly tell me what information that app's told them. When we would probably next promote Orca or a potential Yorkshire Smoke-Free carousel app recommendation is normally around weeks 3, 4, 5, and 6, because most clients accessing service will engage in a conversation of weight management. It's more or less a given that if you're accessing the stop smoking service, you're going to talk to your advisor about weight management or physical activity. It's a given. So at this stage, this is when we would then go back to the carousel, recommend one of the appropriate apps, send it to the client, and again, review it throughout the program. And at any stage of this 12 weeks treatment that we work with the client, we will send them an appropriate app. So it's, you know, it doesn't take over our day job. It's just, it supports what we do as a service. And since those advisors that are bought into Orca find it brilliant. Those who haven't just bought in yet, they're the ones that we're working on still. And this is it's going to take some time. Probably this time next year we'll be all sorted, guaranteed with everyone. But there's still training to do, and we're a big team across Yorkshire. But we've got moving forward. So last slide, if you don't mind. So I just wanted to talk about a bit of data. So I've spoke about the NHS Smoke Free app as one of the 17 apps that we promote. And I just received, before when I put these slides together, the monthly report from Orca for December. And what I recognised, the way it put together, that this information were just like staring at me, and I thought, that's brilliant. I'll put this out there on the presentation. So since April to December, this is when this data is from. We know that as advisors, we have recommended 364 NHS Smoke-Free Act recommendations, typically around that week 1 appointment. So what we know is 255 of those recommendations were actually downloaded, giving us a 70% engagement rate. Well, for us as an NHS service, anything above 55% or definitely 70%, it's working, and we need to keep working on it. And like I just said to you, as a service, as advisors, we know, give us another 6 months of training and development work, this number will be double this number, because those staff who are engaging. But we can do this for each app if we wanted. It's just for now, like I said, we are still learning, but this is one of the apps that we're focusing on. And that's our case study of how it's working in Yorkshire Smoke-Free.
Wow, absolutely fantastic. What a great case study, and really, really, excellent to hear about the progress you've had and the changes made. And can I just say, I think we should work out how we can package Christopher and literally broadcast you around the country when it comes to digitising smoking cessation. I think we'll have a massive impact, so well done. Now, we're going to move on in a moment. Before that, though, I do have a question for you, and I'll just ask Susan the question first. Susan, do you think the implementation of digital health and apps into smoking cessation has actually transformed the service? Do you think it's changed the way the service is actually delivered?
I don't think it's particularly changed how the service is delivered, but it's really enhanced what we can do to help clients. Sometimes they have sleeping problems, anxiety problems. So obviously we do appropriate referrals, but it's encouraging people just to use those self-help tools that are out there in a really easy, accessible way.
And
if I can step in there. I was just going to step in there from what Sue said. I personally feel that it's future-proofed our service. You know, that for us, before the pandemic, we would walk around, and I still remember getting out of my car with that 2 big bags and going into a clinic or in a church room or whatever we were delivering in that day, and we had bags of leaflets and flyers and you name it. So for us to be able to respond, like Sue said, we'll have clients discussing that they have problems with sleep at night and all these sort of things, and we can now just respond really quickly and promptly, and with us moving forward digitally, Orca just fits in. Everything we've done, it kind of just, well, you'd have thought we'd built it around Orca if I'm honest, but it's just fit in. And like Sue, for us as a service, as advisors, we're still doing the same job that we always do, but we're future-proofing. We're not going backwards. We're actually moving forward. So that's how I see it anyway.
That is excellent, and we're going to come back to that in a moment. And I have got more questions lined up for you because I'm really intrigued, especially around the other apps that you recommended to the same group. So we will come back to that. So now it gives me great pleasure to introduce CEO Liz Ashwell-Payne, who I'm sure most of you know, and Ewan McComsky, who is going to also talk to you about the Elective Care Digital Health Toolkit. Over to both of you.
Thanks, Sam, and thank you all so much for sharing your stories. I was just reflecting, one of the things that we always talk about with anybody we're working with is that this is a journey, and I feel that what you've described is exactly that. You've described your journey so far. Yes, of course, there's much more to do, but thank you so much. It's really inspirational and really impressive. So yes, I suppose that this brings us to the Elective Care Digital Health Toolkit, and the reason Orca really looked at this was because we could see across the system, across the NHS, that people were wanting to use digital health technologies to support the elective care backlog. And I mean, Sam laid some stats out earlier on, so it is a bit scary, really. So the National Audit Office is saying that waiting lists could reach 12 million by March 2025. And I'm sure that most of us will know somebody who's on that waiting list. It may even be yourself. And the demand just completely outstrips capacity because of obviously the pandemic. And this is actually not just a challenge here in this country, this is a global challenge. And so people are thinking, well, how could digital health technologies help to support this elective care backlog? So on the next slide, you can see that Orca have been working to really think, well, what technologies out there could we start to embed into care and into pathways to really help people? And we've looked to our amazing partners, as we have on the webinar today, to really look and say, well, how can we broaden this and how can we share the learning we've had to date? Now, what we did in Orca was we looked at 291,000 digital health technologies and really did a big scan around which of those technologies could actually help with this elective care backlog. And what we did was we pulled together, as you would expect, a group of experts, and we pulled 15,789 products that could potentially support the elective care backlog. And what we then did was we assessed these technologies across all the domains that you would expect, but really importantly, looking at impact and evidence of impact. So this is about not just finding safe, quality products, this is about finding those products that are going to have an impact and really understanding who they're going to have an impact for. But again, as you've heard in the case studies, just knowing that there's a long list of technologies that you could deploy to patients and people isn't enough. We need to understand where and when these technologies should be deployed and to whom. And so having a toolkit is all about having that broader impact. And, you know, we know that across the NHS, we have traditionally seen single point solutions being deployed. And this is now about knowing which group of technologies can have the biggest impact. So the toolkit, as you've heard, is technology enabled, but this is about having a best of breed and the biggest impact tools and clarity about how those products are going to be distributed. And they are distributed. Chris, you really shared real clear explanation of how they're distributed via text message within, you know, a number of seconds. And that's really important, because what we need to be doing is making sure that the system that's deployed is also clinically safe and quality assured on an ongoing basis. And so that system allows you to potentially do a recall should it be required if anything changes in that technology. And what we have underpinning, Chris talked about the training, is the Digital Health Academy. And the Digital Health Academy is something that everybody, all of our partners are using, and it actually will be freely available to every NHS health or care professional around about March time. And that's about training the workforce, because we absolutely need to support our workforce in understanding what technologies are out there. So on the next slide, this is a question that a few people have asked me. In fact, my parents, I use my parents quite often as a bit of a baseline. And I was talking about the elective backlog, and you know, they said, well, how can digital technologies actually help with an elective backlog? And so I just really wanted to be explicit, really. The areas that we found from doing this research and this work on trying to find the best technologies is that there are three key areas. The first is around waiting well. Now, an example would be if you're waiting for a hip or knee transplant and you're in pain, actually helping you to wait by deploying a pain management tool or a sleep technology or an anxiety product could help you. And so waiting well is a big area. And as I've said, if anybody knows anybody who's currently waiting, you'll know that it's really challenging for your loved one to have that waiting period. and also the impact on different parts of the system. So in primary care, if you're continuously waiting and are in pain, you're going to see a major revolving door in an already highly required service. The second area is around prehabilitation for long-term conditions. And obviously the third one is that post-recovery. So once you've had your required intervention, helping you to stay well after that intervention. And so on the next slide, just to say that these toolkits, it's not just about buying more technology. We've already heard that from all the speakers so far. If we just buy technology and throw it into a scenario, it just won't land well. This is about choosing the right portfolio of technology and making sure that there's clarity about which stage in the pathway the product needs to be deployed, and having a clinically safe process that also reduces duplicated effort. And so that's the work that we're doing across the NHS with our partners, and we would love to share more learning with you if you're interested. So I'll hand to Ewan, who's going to talk a little bit now about MSK and how it's being used there.
Yeah, thanks, Liz. My name is Ewan. I'm the clinical lead for physiotherapy at Orca. I'm a very proud digital physiotherapist. Just to pick up on what Liz just mentioned at the end there, I've said it before, but I genuinely believe that in my lifetime, technology will never replace a physiotherapist. But a digitally enabled physiotherapist will absolutely replace one who is not. And that applies in different professions, not just in physiotherapy as well. But back to the scale of the challenge, we've heard it already, that the elective care waiting list could reach 12 million people by March of 2025. And whilst waiting, patients are deteriorating as well, creating mounting pressure on the system. And MSK is a massive part of that backlog and the potential deterioration as well. We know that MSK conditions are the largest single cause of disability in the UK. Over 20 million people in the UK have an MSK condition, nearly a third of the population. And 74% with an MSK condition say that impacts on their daily activities. Now, we already know that people with an MSK condition are less likely to be in work than those without. So 62% of those with an MSK condition are in work, compared to 81% of people who don't have an MSK condition. 28.4 million working days were lost due to MSK conditions in 2019 alone. And that's estimated to cost the economy over £2.5 billion. And that could extend, or is estimated to rise to nearly £3.5 billion by 2030. So this isn't just a healthcare problem. This is a whole population. This is a public problem. This is an economy problem. So the challenge is huge and increasing. And as committed and brilliant as our healthcare professionals are, the way that we are delivering services right now to our public just isn't able to keep up with the demand that we're facing. So we need to do something different if we're to shift the tide of the burden of MSK disease. So on the next slide, we can see a quote from Charles Darwin. So this isn't a new thing necessarily, but those running MSK services and those involved in delivering them are already collaborating and improvising to improve the services that they offer and the outcomes that their public are achieving. And at Orca, we want to support that innovation by offering the elective care digital health toolkit as another string to an MSK professional's bow. I'm a proud physiotherapist, and the skills of a physiotherapist closely align with those of an entrepreneur. We're problem solvers, we're creative, we're innovative, we're process oriented, we're empathetic, and we communicate well. So we're the right people for this job. And we're right at the coalface of the delivery of MSK services. So we're in the right place. And despite all of the challenges that COVID has presented to healthcare, what it has done is force us to review the services we provide in a way that many of us haven't done before. So with that and the elective backlog, the timing has never been better to collaborate and improvise so that our public can effectively prevail. On the next slide, we'll see that at times that journey, the public's journey through MSK pathways, it can be challenging, but it can be supported by the toolkit. There are apps in the toolkit to support the public when they first experience MSK symptoms, allowing them to wait well for elective care, This includes Definition Health, who support patients to be surgery ready when their time comes. It has other apps which support patients living with long-term conditions like PhysiTrack, which can support patients remotely to manage their MSK symptoms. All of the apps in the toolkit and all of the apps that are on any part of Orca's app libraries are reviewed thoroughly to allow the clinician to confidently recommend an app at the right part of a patient's MSK journey, improving that patient's outcomes, as well as contributing to reducing the burden of MSK conditions on healthcare. We heard from Chris that it's absolutely essential that the clinicians have this at their fingertips so they know that the apps are technically safe, but they're also backed up by the clinical evidence to make sure that the app is right for that person at that time, at that right place, and for their journey through their MSK condition or through their journey with elective care. Thank you.
Fantastic. Well, look, thank you all. We've got lots of questions that have come in. So I'll turn to the audience's questions first before I turn to my own questions as chair. But just to start off, and I think the first one is really for Crystal. Crystal, you've clearly inspired people listening to this webinar today around the work that you've done across Dorset. Just to get us started, obviously people out there are building different products and working out how they connect through the system. How might providers out there, suppliers, digital health initiatives connect with you in Dorset, and what's the best way of them getting in touch?
So I'm quite happy for us just to share our email. So anyone that's got any queries, please don't come through to our Dorset Digital at dorsetccg.nhs.uk, and we'll make sure that that's circulated to everybody. Certainly, if you are in the southwest, you should have access to an app library already powered by Orca. If not, it will be going live very, very shortly, because that all 7 ICSs that come under the southwest have decided to do a joint commissioning piece so that there is a consistent and equitable offer. So it helps our southwest maturity in these things, and of course we want to all learn together as well. Does that answer the question, Sam?
That does, and it's really reassuring to learn that you're working both with your fellow partners across the southwest, but also to roll out the library. That's really, really reassuring. Turning slightly to a different question, and I'll go to, I think, Christopher first on this question. Of course, smoking cessation, you have to deal with people from lots of different backgrounds, especially those that may have language issues, or they may be in data or digital poverty. How have you coped with people living in data poverty? Question from Anne.
Oh, that's a specific question. Data poverty. Like I said, for us at Yorkshire Smoke Free, we still have for example, our paper resources still available. And if when them clients who don't have, let's say, mobile data, or we still ring them on a landline rather than, it's like when Sue mentioned earlier that we use an e-voucher. We still will engage with the client over a landline, for example, and give them a number to write down on a piece of paper, or we have to go into work to send out in the post some leaflets and bump that we need to get to these clients who don't have internet data. In the last 2 years, it's very few and far between. I can count probably how many times I've had to do this postal service. So luckily, we've not had a huge amount of clients that have needed it. But I will say that we don't have just one age range of clients accessing the apps. It's across the board. There's no specific age, I would say, that engage with this app service. Does that answer that?
That's really helpful, and it sounds like you've got an omni-channel, multimodal service there, and so you're blending both digital and physical resources, which is absolutely fantastic. So, changing question slightly, and I guess this is for both Liz and Ewan. But firstly, Liz, for those people listening, especially those that might be new to Orca and the work that is done, what's the best way of people in the NHS engaging with Orca? And if they've got a question at how they partner or build a library, what's the best way of them connecting to the team?
Yeah, I mean, you're very, very welcome to just drop me or us an email, pop it in the chat and somebody will be in touch. I think there was a question about how we work commercially with innovators and developers. We don't really. You definitely can't get into a toolkit by paying us to support you. You get in if you have the relevant evidence. And that's because we see that we don't want to have any conflict of interest. So anything that we're pushing out has achieved all the quality markers and evidence required to do that. And we continually check for that. If you work in the NHS, reach out, let us know that you're interested. We may already be working with people in your area. So as Crystal said, we started working across Dorset. We now work across all the ICSs across the Southwest. And because those sites haven't yet gone live, you may not know that we're already about to launch in your area. So reach out. My personal email is lizatalker.co.uk. It's the easiest and simplest email to remember, but you can reach out to hello@orca if you want to.
Well, next we've got a fantastic question from Syra, and I'm going to come first of all to Christian, then to Susan, and then to Ewan. So how do we change the minds of those clinicians and HCPs that just do not want to engage? And despite seeing the benefits of technology, digital health, what do we do about that? It would be great to hear from you, Christian, first of all.
Sure. So when we talk about changing culture, that is generally slow. It is a slow process, certainly if you're doing it properly. So in the first instance, it's going to take a while. Secondly, something I learned pretty soon after I started this role was that I have to go for the open doors. There are closed doors and there are doors which are ajar, and some of them I can get through. So if I can get through enough open doors and surround those, let's call them skeptical clinicians, with success stories, then I'm going to be changing the culture around them and they will kind of become enmeshed in that. That's my hope anyway.
Thank you. Susan, what are your thoughts?
I think Chris sort of intimated a few of things that we've done. I think training people is really important. Chris has done a lot of work training the teams to see how easy it is, because that can be a barrier. But then I think as well, getting the client feedback is really useful, because if clients are actually happy with getting the app and they're finding a benefit, then it's very difficult to argue with that. And just a little point to kind of like show that as well is I'm 10 weeks post-operative to a hip replacement. I've had a lovely, brilliant physio face-to-face, but what he's backed all that up with apps, and that's helped me greatly, because I'm hopeless at remembering what he tells me to do, and he's backed everything up with sending me exercises on apps. And so did the MSK service prior to my hip replacement as well. It's been really useful. So getting that sort of feedback, I think then clinicians can't really sort of argue with that sort of thing.
Well, I hope you're having a great recovery, Susan, and that a digital physiotherapist and, well, infamous digital leader, Ewan.
So I can take no credit for Susan's clinical journey, but I'm glad that one of my fellow physios is on the case with that one. And I think that's really important, that we can learn from the patient journey through that. So, you know, Susan, you know, and your personal story of recovery post-hip replacement is a fantastic one, and the more stories we can hear about that, the better. The other thing, I'm just going to flip into the role of a clinician as well, is that what we want to do is we want to demonstrate to a clinician that we can make their life a little bit easier as well. So digital tools can be there to support the patients, and that's awesome, that's fantastic. But with that, digital tools can be there to support the clinician to make their life a little bit easier. So it might mean that as a, you know, Susan's physio doesn't need to be going out to your house to be running through exercises again and again, or re-giving you the leaflets that have been eaten by the dog or whatever else. But we're able to make the service better, so Susan's outcomes are good, but we can also make the clinician's life a little bit better. So we need to try and find the best way of achieving better outcomes for everybody involved in that. And I think that ORCA can be part of that. As I said, it's part of a clinician's offer, as part of a services offer. It's not there to replace when you need it. So when you needed that initial payment, Susan, but it's there to complement the offer that a physiotherapy service has to Susan or any other patient. And it's about choosing the right thing for the right person at the right time. So we need to understand our patients so we offer them the best thing.
That is fantastic. Thank you so much. Well, look, we have come to the end of our time today on what has been a fantastic webinar. First of all, thank you to the entire audience for joining us and giving up your time to be with us today. Thanks to Crystal, Christopher, Susan and Christian for all your insightful comments, views, ideas and suggestions. And again, thank you to Liz and Ewan for sharing with us your experiences and of course how we can engage on the toolkit and with Orca more broadly. So thanks everyone for joining us. You can download the handout, the report. You can go to our website. You can email us. You can connect online on Twitter or LinkedIn, but not, with much less to be said now. But thanks again for joining us, and please connect and share online. And you can always email us. Bye bye, everyone.
Thank you. Bye.
Thanks. Bye, folks.